Today we're getting into GYN emergencies that no one really warns you about. Because here's the truth. Most belly pain, most abdominal pain is not an actual emergency, but the pain that actually stops you in your tracks, that might be your body trying to tell you something. Hi, I'm Anna. I'm a women's health nurse practitioner, and I'm here to help you out, sis. And knowing the difference can save your fertility and even your life. Welcome back to the Tea, where we go over real GYN conditions, no sugarcoating, no fluff, no BS. One promise before we get into it, I'm not trying to scare you. I'm trying to do the opposite, actually. I want you to understand what your normal is and understand what a true emergency is. I want you to stop talking yourself out of something that is actually an emergency and stop panicking over things that may be normal. And that's my whole game here, to know you're normal so you can know you're abnormal. You can know when something is not quite right. A very known female rapper just talked about her experience with an ovarian torsion and how she was screaming in the ER in agony for 12 hours and ended up having her ovary removed. And that's why it's quite important to go over this. She used her platform to share her experience with an ovarian torsion. Your ovary is about the size of an almond, and it's held in place by a couple ligaments that carries its blood supply. Add a cyst and some weight to something that is as small as an almond, it can twist and cut off its own blood supply. Something like a kink in a garden hose. Now, something with no blood supply will eventually die. Think of a brain with no blood supply, a lung with no blood supply, a heart with no blood supply. That tissue will begin to die, and that's why it's an emergency. What does it feel like? Sudden sharp pain in your lower abdomen, usually on one side. Sometimes it's associated with nausea, vomiting, and even a low-grade fever. Now, early on, the pain may come and go, but this is not a push through a cramp type of pain. Nothing that you take is really gonna alleviate the pain. If you're experiencing an abdominal pain that is beyond bubble guts, you go take a shit and it's still there, you need to go to the emergency room. Don't call office, don't send me a message in the portal, go to the emergency room. And that's an ER trip, because the faster you're seen, the better your odds are at saving the ovary. Emergency number 2, an ectopic pregnancy. This one is genuinely a life-threatening emergency. Normally, a fertilized egg implants inside the uterus. With an ectopic pregnancy, the egg implants in somewhere that it can't survive. For example, the fallopian tube. The fallopian tube is so skinny, it is not built to stretch to accommodate a pregnancy. As the pregnancy grows, this fallopian tube can rupture and bleed internally and fast. The signs, usually someone that could be pregnant, whether it be a missed period, a positive test, plus one-sided pelvic pain and some abnormal bleeding. Now, you may have one and not the other, or you may have both. The red flags that mean go to the emergency room now: severe abdominal pain, dizziness, fainting, or sometimes a pain at the tip of your shoulder. So take this with you: a positive pregnancy test, severe abdominal pain, weird bleeding. Number 3, ruptured ovarian cysts. Now, honestly, cysts are extremely common. I see patients come in talking about their ovarian cysts from 3 years ago all the time. Most come and go without you ever knowing. Even most ruptures may cause like a sharp pain and settle on its own. Trust me, this is extremely common, so I'm not here to make you fear ovarian cysts. But sometimes one may rupture and bleed, and the bleeding doesn't stop. Sudden sharp pain, often one-sided, that usually comes after working out or after sex. Line between uncomfortable and emergency is when it comes with dizziness, fainting, when the pain is increasing instead of getting better, heart racing, and heart palpitations. That can mean that you're bleeding inside, and that is an ER visit. Also, this is not a substitute for medical advice. Go and see your lady. Or pelvic inflammatory disease. PID is an infection of your upper reproductive tract. This is your uterus, your fallopian tubes, your ovaries, and it usually stems from an untreated STI like chlamydia or gonorrhea creeping upward. Signs of PID include lower pelvic pain, and this can be a constant, maybe dull, achy pain, pain with sex, foul odor, foul discharge, or abnormal discharge, and sometimes bleeding in between your periods. And some people can also have a general feeling of malaise, like they can just generally feel sick. Some people may have a fever. Here's why it's important to get evaluated and why I won't just let you sleep on this, even if the symptoms are mild. Untreated PID can often turn into an abscess or develop scar tissue within the fallopian tubes, which is a leading cause of infertility and possibly ectopics. So this is where the wait and see if I feel better comes at a cost. Get evaluated, get treated, go see your lady, and get your partner treated as well. This is also why it's important to go for your annual GYN appointment. 5 is severe abnormal bleeding. So let's talk about hemorrhage. This is dangerously heavy bleeding. Heavy periods is one thing, hemorrhaging is another. And there is a line in between the two. So the rule I teach is that if you're soaking through a pad in an hour for 2 hours or more, you need to go to the emergency room. Don't send me a message in the portal. Don't call the office. Go to the emergency room. Passing golf ball sized clots, feeling dizzy, faint, lightheaded, that is no longer a heavy period. That is significant blood loss, aka a hemorrhage, and you need to go and be evaluated in an emergency room. Your body is trying to compensate for the blood loss and is having a difficult time. Fibroids, miscarriages, other causes can attribute to this, but the amount is what makes it urgent. Now, can you prevent all of this? Not entirely, and don't let anyone sell you a supplement that promises you that it can't. But you can lower your risk and catch problems early by going to your annual GYN appointments. Don't skip your screenings. Treat STIs early so that it doesn't develop into PID. And most of all, know your baseline. The women that catch these things early, they know what their baseline is. They know what their normal is. So that's why it's important to know your normal. This well-known female rapper was in the emergency room screaming in agony for 12 hours before she could be taken seriously. Her ovary was removed. She used her platform to share her experience. So how can you be taken seriously? Now, this is not going to necessarily fix the problem, but these are just some tips on how to be heard once you're there. Because we know all too well that women, especially Black women, have had their pain be dismissed. So be specific, be firm. Don't be rude, but be firm. Don't minimize. Say the real words. This is the worst pain I have ever felt in my life. My pain is a 10 out of 10. If your pain is truly a 10 out of 10, it is a 10 out of 10. And if someone tells you, because I have heard this before, like, oh, if you're talking, then your pain is not a 10 out of 10. I will say this: Black women have Black bodies. They're able to compensate until they're no longer able to compensate. And so because you're speaking, that does not mean that your pain is not a 10 out of 10. Say, this is not my normal. Ask to be evaluated. Ask for imaging. Ask for a transvaginal ultrasound. Ask for abdominal CT. Ask to be assessed for an acute abdomen. Ask to be evaluated for an ectopic. Make sure you have a pregnancy test done. And even if you're like, I'm on birth control, I can never be pregnant, still get that pregnancy test done. Naming it changes the conversation. My goal here is that you are equipped with the information to fully advocate for yourself. Even though we should have people advocating for us in the healthcare system, sometimes it just doesn't always work out that way, and you need to be able to advocate for yourself. Knowledge is power. So that is the tea for today. We went over ovarian torsion, ectopic pregnancies, PID, ruptured cysts, and hemorrhaging. Those are 5 GYN emergencies that we never want to ignore. So hold on to one theme: sudden, severe, this is not my normal. That warrants an evaluation. If this made you feel a little bit more confident and in control of your own health, subscribe, like, comment, share. That is the goal here. Knowledge is power, and I want us all to do well. I've got free checklists and questions that you should ask your GYN provider or your healthcare provider linked below. Go see your lady, take care of yourselves, and I hope this helps. See you next time. Bye.